Hello. So this is my case presentation. The first one is Jack Sparrow. So his date of birth is January 15, 2004. So he's 16 years old. The referral source was from DDS, the Department of Developmental Services. Session dates was from September 2019 and to March 2020. So presenting problem, Jack was referred for treatment for problematic aggressive, self-injurious, and non-compliant behaviors at an intensive placement facility to assist learning how to regulate his emotions and decrease his impulsivity. Assessments that have been used are the CANS and behavioral tract disorder. Discharge goals for this individual would be to have the goals for discharge for Jack to be safe to return home with his mother, Amy Sparrow, and his older brother, Steve. Jack, his mother, and his brother have been invested time in his treatment, and have the goal is they want him to return home and have him be out with the community to develop a good relationship, so that'll be good for daily functioning. Some of the strengths for Jack is that he is a 16-year-old young man who likes to watch SpongeBob, read books, play video games, and express himself through art. He likes to use coloring for a distraction and stuff. So he also expressed that later on in life he would like to be a farmer and work with horses. His family is very invested in him, so that's a very good strength. Court involvement. Jack's mother is a legal guardianship of Jack. At the age of 12, Jack went into a neighbor's home and unlocked and stole 2 black powder guns in his home. He was legally charged with this incident, which occurred on July 7, 2016, and his charges were dropped due to the fact that he was deemed incompetent to stand trial. So this is the only legal charge that he has. So communication and language. Jack is an English-speaking individual that can hear and understand and communicate through basic needs using the English language. His mother, on the other hand, her first language is Spanish, so at times it has difficulty understanding what his mother is saying, or she as an individual doesn't really know how to express herself through the English language because Spanish is her first language. Jack also has difficulty with nonverbal communication, so body language and personal boundaries. He doesn't really know how to go about them. His cultural and ethnic factors. So Jack is a Hispanic male. When asked about the ethnicity and the culture, he stated that he didn't know what that meant, so he was very confused what culture and ethnicity was. So his mother, on the other hand, and his family report that they celebrate Catholic holidays such as Christmas and Easter. So the understanding of the services that the parent and the guardians have. So Miss Sparrow is very, very supportive of Jack's needs in the residential treatment to address his behavioral issues and to learn concepts of healthy sexuality. Jack's family is very concerned about his aggression, self-injurious behaviors, and non-compliance. They also are very concerned about his sexual behaviors and would like him to receive treatment to understand healthy boundaries with people. So he'll say things under his breath, not really anything direct, very inappropriate that he would call tics, even though it doesn't really happen. He just likes to lie about it. For the mental status exam, Jack is a 16-year-old Hispanic male with dark brown hair and is a stocky build. Jack he has visual impairments, so during the assessment period he seemed very appropriately dressed for his age and for the weather because it was raining, so he had rain boots. Yet somehow he appears sometimes dirty in the clothes, you might not wash them sometimes. Jack has difficulty with hygiene and prompts to use appropriate material to bring him into the shower, as well as completing other hygiene tasks like brushing his teeth and folding his clothes. So when asked why he came to Stetson at first, he didn't know why, and when asked again, because you have to prompt him a bunch of times, he said, "I went to someone's house," and then because he was bored, and he said that he went into a care and tried to start it the same day. He went into a car and tried to start it the same day. Yeah, so he went into the neighbor's car and tried to start it. And he said, they also answered that when replied for why did you do that, he said the same thing, because he was bored. So Jack also has a tendency to say inappropriate things such as swearing or sexualized comments reported underneath his breath, and he calls it like a tick. Although he looks for reactions of people when he says these certain things, and when ignored, the comments actually like decrease. So it's like the opposite. So that's good. Jack was assisted during this time using 3-word memory call with Jax, and remembered 3 words after 5 minutes, and then after 15 minutes he could only remember 2. Jack is oriented to 3 times, like person, place, or thing, and mathematical questions. When asking him like what the president was, he really was kind of confused, stuff like that. But Jack ever asked if they had thoughts of harming himself or killing others. He said no. However, during this assessment period, he did say that he would make threatening comments to both staff and peers. He also said if he would break the bones of a police officer if they ever came into school. During this assessment period, Jack also had difficulty adjusting to the rules and regulations of Stetson as like a whole, mainly like the residential part, not really like the academic. Like when they go to bed, they have certain things they have to do before that, like chores and cleaning up. So Jack struggles to interact with peers positively in a residential unit and sometimes in the classroom. So he's given a one-to-one staff member to assist him in daily life. So early development and education history. So Jack is born to his mother, Amy Sparrow, and his father, whose name is very unknown at this time. So his mother was in a very bad place, and she says she doesn't want to talk about or give any information about Jack's father. So she did report that he was 6 pounds, 8 ounces. His mother also denies any substance abuse during the pregnancy, but she reports she was using Prozac during the pregnancy because she had symptoms of depression. The labor and delivery was normal. Jack was born with an involuntary oculation of his eyes, so which impairs his vision. So he is supposed to wear glasses, but he really doesn't want to because I guess he's concerned about his looks. But it's basically he'll be looking at you and one of his eyes will drift off to the other side, and he doesn't notice it, but some people might. Sometimes he says everything looks a little blurry. The fact that everything will be fixed with glasses, he doesn't want to do it because of his image. So Jack is involved in early intervention programs at a young age and to address his expressive language disorder as well as behavioral concerns. So Amy Sparrow reports that her son's problems behavior began at a very young age, such as 3, realizing that his behaviors were concerned at school when the school contacted him in kindergarten within school, attention, focusing, and getting along with others. So when Jack was 10 months, he resided in the shelter due to domestic violence perpetrated on Amy by Jack's father. Amy's other son, Steve, resides with the father at this time. So Jack was put in special education services since kindergarten due to his visual impairments, delays, and behavioral difficulties. His aggressive behavior started at an early age and continued. Jack displays social difficulties with peers and adults, which has mostly due to his intellectual disability. Jack was admitted to a psychiatric hospital at the age of 6 and 7 due to significant behavioral difficulties. Jack displayed problematic sexual behavior in this period of assessment in Stetson, and he tried to a couple times expose himself to peers and make inappropriate sexual comments along with gestures, usually under his breath, and then he'll deny it when you try to confront him. So at the age of 12, Jack went into the neighbor's house that was locked and stole 2 black powder guns from his house. He reported that at the time that he tried to start a car at the same day because he was bored, but he couldn't get it to start. Jack was charged with breaking and entering, but the charges were dropped due to the fact that he deemed incompetent to stand trial, so due to his intellectual disability, and was at this time Amy Sparrow in the Department of Developmental Services search for a residential program. So coming to Stetson. So substance abuse. There is no contact with any substance use at this time, nor has ever been used in the past. So medical and mental health history. So placement in treatment history. So at the 10-month-old, so like October 2005, Jack's family was placed in a shelter due to domestic violence. October 2010, at the age of 6, in Brattleboro Retreat. March 11th to March 24th, that's today. 2011, at the age of 7, he went to Brattleboro Retreat for increased behavior. February 15th to March 10th, 2016, at the age of 12, he went to Hempstead Hospital for increased aggression towards family members and in school. So this is kind of like a general, so like Jack's mother, Amy, reported that he did stay at the Crisis Stabilization Unit in Pittsfield, Massachusetts, and another visit to Hampstead Hospital, but there was no like information given in the packet, but this was like the word of mouth. His past medication was Visceral, Trazodone, Fluoxetine, Abilify, Intuitive ER, Risperdal, Depakote, Clonidine, Methadilate. I'm not really sure how to pronounce that. So his current medication is Intuitive ER, Omega, DHA, and Seroquel. To his current diagnosis would be intellectual disability moderate. So like the code would be 319, then like F71. So this is given to Jack for his most recent intellectual testing, with a full scale of 55 IQ. Jack was moderate difficulties, deficits in intellectual functioning, as well as adaptive behavior functioning, which results in developmental delays. Jack's social and communicative behavior are impaired, and he has difficulty reading social cues accurately. Both social judgment and decision making are limited. His other diagnosis is ADHD combined presentation, so that's 314.01 and F90.2. So this is given to Jack for his impulsivity, hyperactivity, inattentiveness, and the impact of social, academic, and daily functioning. And then that also helps with like his one-to-one assistance, helping him stay on task and completing daily activities. His other diagnosis that was in there was oppositional defiant disorder, but we're going to rule it out because it doesn't really meet the full criteria. So it is 313.81, so it's F91.3. So it's given to Jack, often loses temper, defies rules, and annoys others, impacts negatively on social, educational, and occupational or other areas important to daily functioning. It is unclear at this time that he meets the full criteria, but it is definitely present in some aspects, but not the full diagnosis to meet for the needs. In addition, it is not clear if Jack is deliberately annoying others in his social and intellectual impairments to lead him to gain attention in like a non-adaptive way. So this diagnosis occurs more assessments. So treatment recommendations that I would really like to work with him with is social skills, like either like in a group or individually. So predominantly this is a style of I want to use like Erik Erikson's stages of development and by the Silk of Social to demonstrate the importance of how social skills affect every individual's life and every day by interacting with others, staff members, family members, professionals, and including yourself. So this can be an individual setting or in a group. So individual will be good to work on your own personal needs and growth, and in a group the actual the whole point of interacting with others and following rules. So social skills groups would show how to interact appropriately with one another, as well as learning how to regulate yourself in settings where you might not feel regulated. And then the other one I would suggest would be pet therapy. So predominantly a dog or a cat, because he really likes animals. And this individual will benefit from pet therapy because it practices how to manage, take care, and handle an animal. This can help calm the mind in a therapeutic way by providing comfort and care. And this also would be promoting independence and empathy. I know he always talks about wanting to get a cat, but his mom won't let him, so I thought it would be kind of nice to get that practice of, if you ever did get a cat, what it would be like. So, yeah, that's my presentation for the case presentation 1 for Jack Sparrow.